Hello lovelies, welcome back to my channel. Today's video is about personal hygiene in pregnancy and then how to maintain your health during pregnancy. So kindly don't go anywhere, watch today's video to the end. On my previous video I talked about the importance of antenatal care and the filling of the antenatal book, so we'll leave the link down below at the description box so you can go check it out. And hey, if you haven't subscribed yet, kindly subscribe to this channel and be part of this beautiful family. I'm Janeospace, your community of nurse backup, and this channel is about health education for kids and adults. Let's dive into today's video. Talk about personal hygiene. Personal hygiene is how to care for your body, and that practices include bathing, brushing of the teeth, hand washing, and a whole lot more. So personal hygiene practices help you and the people around you to prevent illnesses and an infection. It also helps you feel good about your appearance. Let's take the bathing, how we should go about it. So we bath regularly, at least twice in a day. That's every morning and then every evening. When we are bathing too, of course, we use soap, sponge, and then our towel, and then our clean water. So when we are bathing, we do not have to wash internally, that is the vagina dutchie. So you just have to wash around the vagina, but you don't have to dip your hands inside the vagina. So when we are done bathing, you have to apply lotion or a cream immediately after bathing or showering to smooth and then softens the skin. And then you have to use deodorant or a natural deodorant like the lime. You can use the lime in your armpits for some time before you go and bath, and this will help prevent body odor. Then again, you have to brush your teeth twice in a day. That's in the morning and then in the evening. And with the brushing of the teeth, you can use a chewing stick or a Pepsodent and the brush to brush your teeth. So if you don't have Pepsodent and then brush to use, you can use chewing stick, and it's quite okay. You have to shave all your pubic hairs, that's underground and all that, to make that place to neat. And then also we have to wash our hair at least twice in a week, or if you have your braiding on or something, you always have to make it neat. And if it is old and smelly, you have to take it off and then do another one. Then you have to cut, and then also cut or trim your fingernails and then your finger toes as well. And then good hygiene will also help prevent vaginal infection. Okay, so you have to avoid intimate deodorant and then scented products. Then you have to also change your undies and your braces every day. Sometimes if you are working on a pregnant woman, some of them, not all of them, some of them, they smell, you can't even hold it. So please, if you are pregnant, that doesn't mean you don't have to take good care of yourself. Pregnancy, we say any area, pregnancy is not a disease. So please, you should take very good care of yourself whilst you are pregnant, before even the pregnancy, during the pregnancy itself, and then afterwards. Okay, all right. So the next thing to also look out is rest, relaxation, and then sleeping. You have to get enough rest to restore your energy, and then you have to get support from your partner or other family members with your household chores or work and whatever. And anytime you are working and then you feel tired, just have some rest and then you continue with it. Okay, all right, so let's look at some of the things that we are to avoid when pregnant. So things to avoid during pregnancy or when you are pregnant. First thing is smoking. Yes, if you are pregnant, you don't have to smoke. Do not smoke when you are pregnant, because smoking during pregnancy increases the risk of health problems for developing of the babies, including preterm birth, low birth weight, and defects of the mouth and the lip. Smoking during and then after pregnancy also increases the risk of sudden infant death syndrome. So please, smoking during pregnancy, it's not good for you and then your baby as well. All right, the next thing not to do is taking an unprescribed drugs or concoctions. Taking unprescribed drugs can lead to your disease getting worse, or hospitalization, and even death. And this goes to everyone, not only pregnant women. Anytime that you are sick or something, please, especially with my pregnant women, do not go to a pharmacy to purchase drugs on your own, please. Not all the people selling at the pharmacy are pharmacists. Most of them are SHS leavers and stuff. They only tell them that when somebody come and this, that. And maybe you might not be lucky, you won't go and meet the right person, and the drug that will be given to you would even have an effect on you and then your baby as well. So anytime you are sick or something, please just go to the hospital with your complaint, and then we will attend to you accordingly. And with the mixing of concoctions, you know that our mothers, our grandmothers, sometimes when we are pregnant, especially when your time is due, they will ask you to take some medicine that will help save labor and stuff. Please don't take any source of that. Just take the hospital medications or your routine medications that we give you, not any other thing, not any concoction and other stuff. Okay, all right. So the next thing not to do when pregnant is intake of alcohol. You are not to drink alcohol during pregnancy, because alcohol also increases the risk of miscarriages, preterm birth, and then your baby having a low birth weight and birth defects like heart defect, hearing problems, or vision problems. So taking alcohol can cause problem in overall health. So please take note and kindly put a stop to it if you are pregnant and then you are taking alcohol, being a wine, a beer, or whatever. So far as there's an alcohol content in, kindly don't take any of that, okay, so that you carry out a very safe pregnancy. Another thing to also put a stop to it when pregnant is lifting of heavy loads. Heavy lifting, standing for a long period of time, or bending down during pregnancy could also increase your chance of miscarriage, preterm birth, or injury during pregnancy. And then also engaging in strenuous work. Strenuous work will also make your heart beat faster, so do not stress so much or do not do strenuous work, okay? All right guys, so we'll end here for today's video. In my next video, we'll talk about diet and then nutrition in pregnancy. So if this video is useful, kindly give it a thumbs up, like my video, share as well, and then comment down below at the comment section. Kindly subscribe to this channel if you haven't subscribed and be part of this beautiful family. Also hit the notification bell so anytime I upload a video, you'll be the first to get it. See you again in my next video. Bye guys.